Greetings and welcome. My name is Selena Belisle. I am the founder and one of the ethics instructors here at CE Institute. And today I'm going to review with you the National Board's Code of Ethics. Now, if you notice, the last time they updated or revised their Code of Ethics at National Board was on September 15th, 2017. And I'm recording this as part of our 2025 course curriculum. So it's been a while since they updated their Code of Ethics. Reason being is that ethics don't usually change, right? Our morals and what we're supposed to do is usually the same thing over time. So let's review what the National Board considers to be its own Code of Ethics. NCBTMB's first code of their ethics policies is have a sincere commitment to provide the highest quality of care to those who seek professional services. So you see that this practitioner in this picture here is using a bamboo to provide bamboo massage. You should be sanitizing that bamboo to the highest level possible between clients. Let's say you run out of sheets. This is another way where this ethics code would be applied. If you run out of sheets, you shouldn't flip the sheets over. Have any of you been in practices where your employer told you to flip the sheets because they don't have any fresh laundry? Because I've been employed in those situations, and I don't want to do that. That's unethical. It's dirty. You can't just flip a sheet over and think it's clean. They don't understand viruses and bacteria when somebody proposes to do that type of practice. The more ethical thing would to be cancel the appointment and just say, due to unforeseen circumstances, we're unable to keep the appointment. Or you can even offer to the client and be honest with them, especially if you know them. Say, hey, you know something, our laundry service got delayed. We are out of fresh linens. We either need to cancel your appointment, or if you bring your own sheets, and I need at least 2 twin size sheets or larger, we'll give you $10 off today's appointment. And that allows you to provide the appointment without having to cancel it. And, you're being honest and ethical with your client instead of doing something that would be considered dirty practice and unethical. Another sincere commitment to the highest quality of service is to provide the amount of time that the client has purchased. So if they're expecting a 50-minute massage in a 60-minute appointment, make sure they have 50 minutes of hands-on massage time. As an employer, I can tell you something that's really upsetting to me is when my staff was doing less time for their hands-on appointments than what the client had scheduled or booked. And when they would come into the reception area early, or I'd see them in the staff break room on their cell phone instead of working on the client, I knew I had an unethical therapist that was cutting clients' appointments and sometimes even trying to hide it from me. And my experience is when somebody's unethical one way, they're unethical multiple ways. And when you're working for someone else, you risk your employment and job if your employer is not comfortable with your work. So make sure that when you are practicing massage, you are providing the highest quality of work possible for everyone. I'm going to review some of these codes of ethics in an order that NCBTMB does not provide, because I think some of these codes are more important than others. This code right here acknowledges the limitations of and contraindications for massage and bodywork, and refer clients to appropriate health professionals. This one's important because sometimes clients come in and they're taking some medication you've never heard of before. If you don't know what the medication is, you should not provide the massage. Sometimes that medication might be for communicable disease. And not only will you acquire their disease, but you could spread it to other clients. Can you imagine? So there's an example of why you're not going to work on clients who tell you they're on a medication. They might not tell you they have the communicable disease because they want the massage. They don't care what happens to you or your other clients, but they might have accidentally written down that medication, and now they're not going to tell you what it's for because they are not fully disclosing. And how many times have you had clients do that to you as well? Unfortunately, clients will come in and they want deep tissue massage and they're on painkillers or blood thinners and reasons why they shouldn't have deep tissue massage, and they withhold that information from you so that they can get what they want despite the repercussions that it might be harmful for them, right? Because if you do deep tissue on somebody who's taking blood thinners, you probably bruise them. We know of one instance where somebody had a deep tissue massage with a blood thinner and ended up in the hospital with a blood transfusion because they literally had a bruise. They were bleeding out in their own tissue. That's contraindicated. And people who are maybe on oncology treatments or diabetics who have neuropathy and can't feel because of the neuropathy, you do a deep tissue on them and you damage their tissues. Oncology clients, their bones are compromised. Usually you could even fracture a bone. So these are the reasons why we need full disclosure in the appointments. And if you're not trained to work with a specific medical condition, such as oncology, or look at the picture that I'm showing on the screen right now. This is somebody who has severe scoliosis. And if they have some type of medical condition that you don't know how to work on, then you shouldn't do it. Some people will have screws and bars in their back to help correct their scoliotic condition. And believe it or not, when you have someone like this, if they have hyperkyphosis, or scoliohyperkyphosis, where they're hunched forward, this compresses on top of the heart and vital organs and can literally shave life expectancy. They will live shorter periods of time when their organs are compressed. And they might want paraspinal bodywork or deep tissue massage. But if you're not trained to work around these screws and bars and you haven't received specific information about what's safe and what's not in specialty training, you shouldn't work on this because you don't want to do any harm. Do no harm, right? Doctors take that hypocritical oath, but we don't. And as massage therapists, we should be taking that oath, even if we're not doctors. We don't want to hurt our clients. If you don't think you can help them, such as a client has neuropathy and they want deep tissue. Hey, I can't do deep tissue on neuropathy where you can't feel this. I'm not even supposed to work the area where you have lost sensation. But I can give you this instead, and it might be a Reiki session or a hands-on energy session. We do suite sessions here at the school for clients who are generally contraindicated for massage. Try and provide them something you're trained in, and respect the fact that if they don't want that, if they came for a specific purpose to get a specific service and you're not able to provide it for whatever reason, you don't know what their medication is, you can't find it online. I had a client who came in once and told me they had cancer, but they didn't know what type of cancer they had, and they're on chemotherapy, drugs, and other drugs. She had a long list, but she didn't know what any of the drugs were for. And I'm like, listen, I don't feel comfortable working on this. Do you have sensation in your feet? I could do a foot reflexology massage, but I don't want to increase your circulation, because I don't know if that could be harmful to your health, or if that would be something that wouldn't be appropriate with a medication that you're taking. I just don't want to do any harm here. And it's a Sunday. I can't reach out to your doctor and get that information this moment. So this is what we can do instead. Those are examples of what National Board are wanting you to exercise when you have somebody who comes in. You got to review for contraindications, make sure that what they're wishing for is within your scope of practice. And if you cannot follow those guidelines, then perhaps refer the client to another practitioner. Yes, you might lose the appointment. This is why it's great to do client intakes with new clients online before they get to your office, so you don't miss out on an appointment and payment, and the client doesn't waste their time either. Massage therapists and body workers need to be honest about their qualifications, and that's The next code here, which is represent their qualifications honestly, including education and professional affiliations, and provide only those services that they are qualified to perform. That means if you have a pregnant client wishing for massage and you do not have special prenatal training to work on pregnant women, you should refuse the appointment and try and refer the appointment to someone who, hopefully you're in a group practice, somebody who's received prenatal training to work on them. Let's say the client has eclampsia or preeclampsia. Now, if you've had prenatal training, you know what that is. If you haven't had prenatal training, you've never been pregnant or been through a pregnancy, you might not know what that is. And that's a contraindication, which you would learn in prenatal massage training. So being great at side-lying massage is not a good enough reason or qualification to do things like perform prenatal massage. Make sure that you're following your qualifications and be honest with the client. If they say they're pregnant and you don't have prenatal massage training, I'm sorry, I'm not trained in that field, but I'm trained in these 13 others. When you're no longer pregnant, I can see you and let me get your referral for prenatal massage that you can have services during your pregnancy. Massage therapists and body workers should only provide treatment when there's a reasonable expectation that it's going to be advantageous to the client. And I have a rule of three, which I'm going to review with you today, okay? In the rule of three, if I don't know if the massage will be beneficial to the client, I do know that massage has some health benefits. But let's say they come in with back pain. I can't guarantee that they're going to feel better and their back pain will be resolved after a massage. And I'll tell the client that, and I'll be honest with them about that too. Sure, we can do back massage. I hope it does help, but I can't guarantee that it will. Most people do feel better after a massage, but the only way that we're going to find if this is relieving for your back pain is to try it, as long as there are no other contraindications. Now, let's say we do the massage and the client does not have any back pain resolution. They're still in pain. If they're in worst pain, we're not going to repeat that massage again. No more. They need to see another specialist to try and resolve their pain with someone else, because we know that the massage, they felt worse afterwards. It might be a one-time thing, but I'm not going to chance it and profit from creating greater pain for my client again. That's just unethical. If I did the massage and they did not have back pain relief, I usually can provide up to 3 appointments. So your 3 services until, after the 3rd appointment, if it doesn't feel better, I'm just not going to keep on doing back massages on you. This isn't working. This isn't advantageous for you. If you're truly here for pain relief, then for back pain relief, then you need to seek something else, because it's not ethical for me to keep on doing back massages for back pain relief if you don't have any, especially after 3 visits. The same with reflexology. If somebody has booked reflexology because they're wanting to breathe better or something that they think reflexology will help with, I might do 3 appointments, and if they're not getting the benefits that they want, then I'll cease to provide any more service. And sometimes the clients will say, but I like the way it feels, or, I feel relaxed, or I get this other benefit out of the service. At that point, I can say, yes, I will continue to provide the service for you, but now I'm no longer providing this for back pain relief, or I'm no longer providing this to help you breathe better, or whatever their initial reason is. You need to have that type of communication with your client so everything is ethically above board. You're not missing the client's goals. We know why they were seeking their service, because it provides them relaxation, or they like the way it feels, what have you. That's fine. But you never want to repeatedly provide service beyond like 3 times if the client's not getting true benefit from the service. You don't repeat the service ever if they actually feel worse. Another code is to inform clients accurately, as well as other practitioners and the general public, of the scope of your practice, your discipline, your limitations as well. So let's say you practice reflexology and a pregnant woman online sees that reflexology can induce labor. Okay. And she calls you to induce labor with a reflexology appointment. No, you cannot induce labor with reflexology, folks. It's not medically proven. It just doesn't work. If it did work, hospitals would be practicing reflexology instead of pumping pregnant women full of drugs to induce labor, right? It'd be that simple. It'd be more cost effective too, right? Also, I gave the example earlier of back pain relief. Well, yes, massage often does relieve back pain, but it's like taking a Tylenol. Does that relieve all headaches? Of course not. So that doesn't guarantee that massage will relieve all back pain either. We're individuals, and every individual responds differently to different types of medical treatments and so forth. So when you're advertising your services, when you're having conversations with clients, make sure that you accurately respond to their goals and let them know what your limitations might be. Another national board code of ethics is consistently maintain and improve professional knowledge and competence, striving for professional excellence through assessment of personal and professional strengths and weaknesses, and through continuing education. So let's say that you are being ethical and you're denying appointments for clients that are pregnant or have scoliosis or so forth because you do not have specialized training to work with those clients and they want work for those particular medical conditions. You can take more training, continuing education classes like we're offering here at the school, work with others and to learn more, read books, watch training videos, do whatever you can to improve your own knowledge, research, and so forth so that you can provide the best service possible to all of your clients. Massage therapists and body workers should conduct their business and professional activities with honesty and integrity and respect the inherent worth of all individuals. And I'll give you an example that we're just going through. And let's say that somebody comes in with a political statement on their t-shirt. We see a lot of Facebook activity in massage therapy groups where practitioners are questioning, this person loves Trump or Harris, and they keep on going on about it during the massage appointment. And they get into arguments and so forth because they don't share the same beliefs. It's okay to have disagreeing beliefs with your client. That should never enter the treatment room. And you might want to suggest to your client, this is a place of medical treatment and relaxation and so forth, so we don't have any types of conversations that people consider taboo, like religion, politics, and so forth in the massage therapy treatment room, just out of respect for me and yourself. And it's really important to rise above, whatever your personal feelings are so that the integrity of the treatment remains and it's ethically responsible as well. You don't want to provide the person lesser treatment, cut their appointment time, and so forth because you disagree with them and whatever their personal beliefs are, whatever they bring to the treatment room with them. It's really important to treat everyone equally as if they are your star client. So that means refuse to unjustly discriminate against clients and or healthcare professionals. When I owned a very large group practice, sometimes we would have an entire family coming in to see us for their massage services. And sometimes we'd have one member of the family that was just a really bad client. They'd show up intoxicated or be really loud and boisterous to the point that we would have to refuse service. That doesn't mean that you use the experience with one family member towards the rest of the family. They haven't violated your policies, so don't let that line be muddied when there's an association. The same with healthcare professionals. I had a doctor who really undermined my practice and tried to set up one of my massage therapists for their employment and referrals, and literally just try and take business away from me and my staff. And we were seeing a lot of the same clients we've been referring back and forth for years. So even when new clients of his were coming to seek us for service because we had a stellar reputation, above and beyond like whatever new business operation they were setting up. You can't let the waters be muddied that they're coming from a place that you are detesting right now. You need to allow all clients to have their own autonomy and provide them the best service possible, regardless of what's happening outside of their individual situation. The next code that we'll review is to safeguard the confidentiality of a client's identity and information in all conversations, advertisements, and all matters. Unless the client gives written consent to disclose their information, or other exceptions can be if it's required by law to disclose it or medically necessary. Let's say the client's in a coma and they can't give you information, and the doctor wants to know what you did in the massage right before they slipped into a coma. In that case, you can disclose because it's in the client's best interest and they're not able. That's one of the few rare cases. Let's say also you worked on a professional athlete. You can't say, hey, I worked on, so-and-so last week to anyone, even your spouse. That would violate the client's confidentiality. It would be unethical, and it'd also be a HIPAA violation. You could lose your license doing something like that if it's reported. So it's really important for various reasons to never disclose the client's confidential information, including their identity, unless you have written consent to do so. Let's say you're working on that same professional athlete and you want to take a picture of them, which when I worked at Ritz-Carlton, you couldn't ask for photos like that. It's not considered ethical to take photos with your clients. Does your doctor take a picture with you? Probably not, right? So, but I can see the interest in, taking this picture, and, you would just need to make sure that you have the athlete's consent, and I would get it in writing to share with others if you want to show that picture and promote it with your practice. Now, keep in mind, most athletes make money off from endorsing things. They get paid for endorsements, right? So if you're going to use their likeness and their image to endorse your business or promote your business, you need written consent stating that you can do that, their consent, that that's allowable by them. You might want to provide a free service in exchange for that endorsement, because the client could revoke it. And let's say you have this printed, on your business cards and so forth, and it's going to cost you money to change all that and remove that endorsement. If they've provided that endorsement with some type of compensation, it might not be revocable. That's a legal matter. You would review that with a licensed attorney to exercise that. But in general, National Board's code is keep the client's information confidential. The next code that we'll review is to respect the client's right to treatment with informed and voluntary consent. The practitioner, which is you, will obtain and record the informed consent of the client. Informed consent is you've given the client all the pros or possible cons of the treatment, and they are informed to continue with this knowledge. You can get this informed consent either verbally or in writing, and it could also be a client's advocate, such as a parent of a minor child. However, let's say a parent brings in their child, a minor under 18 years of age, and they want their kid to get a massage, but the kid doesn't want a massage. In that case, because the minor child, who's their own human being, has refused consent, I don't provide the massage, even if the parent wants it. That's an absolute no-go for me. Also, let's say the client is answering the phone in the middle of their massage, or they just remembered that they left their stove on at their house and they're afraid their house is going to burn down and they want to terminate the massage. That's fine, but you might still want to charge for the full appointment, especially if this client's new to you. It's your time, and they're terminating the service due to no fault of your own. Okay, anytime somebody wants to stop the service and not continue, you must stop, period. You do not have the legal right to continue working on them if the client withdraws their consent. Also, let's say that from the back pain story I told earlier, you can't guarantee pain relief. Yes, massage has proven to relieve back pain, but it's not for 100% of people. Some people have different medical conditions where that pain relief is not going to be achieved through massage. And we usually don't know if that's their case until we've actually provided the service. So if the client then says, well, I don't want this massage unless you will relieve my back pain. Well, they have informed consent. They know that, you can't guarantee it. And now they're withdrawing their informed consent because they know that it's not guaranteed. You don't provide the service in that case. You might still want to charge them for a last minute cancellation. They might have wanted to ask when they booked the appointment if the massage will relieve their back pain instead of book an hour and come to your practice and then leave you with, no work and no payment. You can charge consultation fees, whatever you feel is appropriate. Just make sure these are ethically disclosed up front to your clients publicly. These are all examples of providing treatment with informed consent and not providing it when consent is not present. So an absolute must is to respect the client's right to refuse, modify, or terminate the treatment for any reason, regardless if they're on the table, if they've given prior consent. Once they say stop, we must stop. After you've stopped, you can ask them, do you need a different therapist, or is there something different I can do? But if they say stop, we must stop. Another code of ethics is to provide draping and treatment in a way that ensures the safety, comfort, and privacy of the client. So if your client does not want draping, that's usually not an option, okay? I can't really think of an example where it would not be appropriate unless the client's fully dressed and then draping is no longer required for privacy. Okay, so if a client comes in and says, I don't want to be draped, that would be unethical to provide the service. We do need, when you go to your doctor's appointment, let's say you have a gynecological exam, they still give you a gown to put on. Or a prostate exam or what have you. You're still wearing a gown. It's not like you're just standing in a doctor's office naked. Well, the same applies for the massage profession. Draping is required, and it's unethical to practice without it. Exercise the right to refuse to treat any person or part of the body for just and reasonable cause. And let me give you an example for this type of code of ethics. I was working in Miami Beach and a client came in covered with bug bites. They had been attacked by mosquitoes while out the night before. And there wasn't more than like an inch or two of skin that did not have broken skin because of bug bites. And I refused the service. So we didn't provide it because you cannot work over broken skin that's at very high risk of infection, especially when it's a full body issue. Okay. And that is a justifiable right to refuse service. It's up to you to determine whether or not you would still charge for the service. I did not, because the client just didn't know. They couldn't, they thought the massage lotion would make the bug bites less itchy. And no, I just simply refused the service, and I took my lunch break early and I went out and got another service booked for when I was supposed to eat later. Their friend only had bug bites on their legs. Their back was covered. So their friend was able to get a massage, but it was modified to the back only because they had bug bites on their extremities. So this is a perfect example of where treatment could be refused for reasonable cause. Anytime a therapist provides a massage or bodywork session for financial benefit and it's at the detriment of the client, such as if I would have massaged the client full of bug bites because I needed the hour payment, that would be considered unethical. You should never provide service for payment just to get paid when there could be harmful effects or detriment to the client. National Board's code is for massage therapists to refrain under all circumstances from participating in a sexual relationship or having sexual conduct with a client, whether it's consensual or not, from the beginning of the client-therapist relationship and for a minimum of 6 months after the client relationship has been terminated. They say unless an ongoing sexual relationship existed prior to the date of the therapeutic client-therapist relationship began. I agree and disagree with some of this code. I feel it's 100% you should not date your clients or have any sexual contact with them whatsoever, period. However, sometimes there is a rare occasion, a one-off, where, this can't be avoided according to, some people. And if that's the case, first of all, I would consult an attorney if you're going to date or have sexual contact with a client to make sure the client relationship must be terminated. And I would consult an attorney about getting that terminated in writing as well, legally. I don't believe that if you're having a sexual relationship with a client that they can enter and be a paying client for massage service. National Board makes that allowance. I don't. So that's something, it's an ethical choice, okay, that we all need to decide. So this is why we have these ethics trainings and ethics conversations. There are choices to be made here, and you need to make the best ethical choices for your own practice. Therapists should avoid interest, activity, or influence which might be in conflict with a practitioner's obligation to act in the best interest of the client or the profession. The best example I can give about this code of ethic is when therapists are retailing products, and I'll give essential oils as an example. If a client came to your practice and they didn't inquire, they just wanted a relaxation massage, and you're promoting essential oils for relaxation during the entire massage. They didn't come there for essential oils, they came there for massage. It's something different. So I feel that therapists are being unethical if they're going on and on and on and on about buying this essential oil just to make their sales commission or make some retail quota with the employer or something like that. That's where there's a conflict of interest when you're trying to make sales goals and satisfy clients at the same time. Try and make sure your practice is always ethical and you're not in muddy waters trying to obtain some other objective that does not align with the client's wishes or needs. At all times, we're going to respect the client's boundaries with regard to privacy, disclosure, exposure, emotional expression, beliefs, and clients' reasonable expectations of our own professional conduct and behavior. Practitioners, and that's us, will respect the client's autonomy. So even if you feel you've been disrespected by the client, we still need to be professional about it. You can just say, something, we can't have this discussion right now because I'm here to provide your massage appointment and we need to focus on your goals and providing an efficient and effective treatment. Shut down any conversations that aren't appropriate or offensive in a respectful manner. And don't let any of that conversation influence your treatment. Even if you've been offended or hurt, you still need to provide the best service possible and exactly what the client is paid for. Refuse any gifts or benefits that are intended to influence a referral decision or treatment, or that are purely for personal gain and not for the good of the client. And an example I can give to you on this is, let's say the client has COVID and they still want their weekly massage, and they baked you this beautiful cake because it's your birthday, and don't worry, they're going to wear a mask and they still want to get their massage during COVID. And if they wait until their COVID is over, then the cake will no longer be good and it'll be spoiled. You can't have them commit, like anything the client does for you shouldn't influence your treatment decisions. If you wouldn't provide the treatment or a referral or what have you without the gift, then you can't do it with the gift, okay? We can't be influenced by what clients are trying to do to manipulate us. If you want to see the National Board's Code of Ethics, I put their website URL address right here on this slide. It's ncbtmb.org/code-of-ethics. Also, if you'd like to participate in some of our training at the school, our website is ceinstitute.com. With full disclaimer here, I do not work for National Board. I do not represent National Board's ethics department or anything like that. I simply am the founder and one of the instructors here at CE Institute, where we teach CE hours for licensed healthcare professionals to renew their licenses. We hope you enjoyed this training, and we hope to see you at the school in another training. Until then, be safe.